Hello everybody! Thank you so much for voting on a topic for this video. Today I'm going to be talking about mapping inequities through GIS as well as data analysis. It really all blends together. Public health is a really broad field and we all kind of tie in different aspects. So when you were all voting, many of you voted for talking about mapping inequities as well as data analysis, and I figured, well, you can't have one without the other, so I may as well talk about them concurrently. I'm also going to be sharing a little bit about UVM's Continuing and Distancing Education Center for Leadership and Innovation. I want to thank them for having me as an ambassador for the last around 8 weeks. It's been a really awesome experience to be able to share with all of you a little bit about what they have to offer and how it relates to what I've been doing for almost 5 years now. So it's just been a really amazing opportunity again to share with you and discuss what I'm doing as well as how it all comes together and how their courses could really benefit all of you and your careers no matter what you're doing and where you are in it. So thank you so much for coming on this ride with me, and thank you for your comments and your questions and for voting. I'm going to be announcing the giveaway of the gift cards down below. So thank you again, but let's kind of get into it. I'm going to try not to ramble too much, but I tend to be a little bit rambly. So as many of you know, I have been studying public health for almost 5 years. I will have my master's in public health in just a couple short weeks. I finished classes in 10 days to be exact, not that I'm literally counting every single day. It's been a really crazy time to study public health, especially over the last year and a half. A lot of the focus on public health has been around epidemiology and infectious disease control, and that's kind of been the forefront of everybody's mind. But there is so much more that this field has to offer, and I want to get into that with all of you. So first I want to start by talking about GIS, what it is, how I use it, how others use it, how you could use it. It's definitely not something that is specific to public health. GIS technology is used everywhere. It ranges from the GPS on your car or the maps on your phones. It's all GIS. So GIS stands for either Geographic Information Systems or Geospatial Information Systems. And then there is GI Science. So that is Geospatial Information Science, which is kind of more where I use all of this stuff, more in the social sciences and mapping resources and exposures. So to kind of break it down in simple terms, it's literally just using technology to take a picture of the earth and map where things are. Pretty simple, very similar to GPS technology. So how do we use that in public health? So we use it to look at a population, to look at the resources they have access to look at the exposures in their environment. So in public health, we talk about environmental health. And growing up, I really thought that only involved, air pollution and things that are in the air and kind of the more science side to things. And it wasn't until I started studying public health where I realized that environmental health in public health can also just include your direct environment. So for me right now, I'm sitting outside. Something to note about my direct environment is I have a beautiful amount of green space, and access to green space is huge, and it's not available to everybody. It's something that certainly benefits our health, and studies have shown that people who have more access to green space live healthier, more successful lives. So when we talk about environment, we may literally talk about our homes, the air we're breathing in our homes, what is right next to us, what we don't have around us. So with GIS, we're able to map where different people live. And what we do with GIS is we're able to take different maps of different areas and kind of lay them on top of one another. So a lot of what I do is taking, for example, a map of a neighborhood and the houses that are in that neighborhood, and you lay on top of that a map, for example, of air quality. So a lot of parts of environmental health is looking at things such as air quality. So we're able to take a map of a neighborhood, and on top of that map, you put a map of air quality, and we get that data from a different information system. So GIS is a way that we can compile all different information systems together. So let's say we have a map of a neighborhood. As I mentioned, you have a map of air quality. On top of that map, you can put a map of grocery stores. Where do they have access to grocery stores? Because that's a social determinant of health. Your access to resources plays a huge role in how healthy you and your families are able to be. So now we've got a map of a neighborhood, a map of the air that they are exposed to, a map of the resources that they have access to. Grocery stores, parks, rivers, lakes, all these different things. It may be water quality. You know, we can look at data that's been collected from organizations that compile a system looking at, you know, water quality. So you kind of compile all of these maps, you lay them on top of another, and it gives us a huge picture of that environment versus just the first map that we started with, which was a map of a neighborhood. So what does that tell you? And then from there, you can lay on top a map that shows the different races and ethnicities in that neighborhood. You can show a map of the ages in that neighborhood. So all of this data together gives us a really full picture of the experiences that these people are having. So one of my favorite examples in terms of something awful that's happening not far from me that needs to be addressed and has been needed to be addressed is Newark, which is, for those not familiar with New Jersey, Newark is a city in New Jersey. It is a very poor city. It has horrible air quality, and it has for years and years. And there's a huge, it is also the city in New Jersey, one of the cities in New Jersey that has the highest Black population. So when you look at a map of Newark and you look at race and ethnicity, you look at air quality, you look at the different power plants in the area, you look at these, you know, big buildings or organizations that create a lot of pollution in the air. So you're able to really see what these people are being exposed to and how that may correlate to different issues that they have. Because also on those maps, you can do a map of hypertension prevalence. Hypertension is high blood pressure. You could look at a map of heart disease, you could put that on the map, diabetes. So all these different layers that we add to our maps to get a huge picture of the population, or a more full picture of the population, that's all GIS technology. So one of my favorite things is being able to pull from different systems to get a broader picture. You know, it doesn't make sense for just one person or one organization to take all that different inventory. You know, I can't go out into a community and map out their whole community, but what's awesome is through GIS technology and the science behind it, we're able to pull from different surveillance systems and get a really full picture. I talk a little bit more about public health surveillance in another video if you would like to check that out. So it's really cool. And then from there, we take the data and we analyze it. So we're able to, through modeling, we're able to control for different factors. So let's say I have a population of 500 people. Probably not a big enough population to get a statistically strong sample and findings, but let's just keep it simple, 500 people. So of those 500 people, I can then control for race and ethnicity. So let's say I'm looking at 500 people and I want to see their rates of lead poisoning or of heart disease or hypertension. So that would be my outcome that I'm interested in. And I'll have a bunch of different predictors. So let's say I have a population of 500 people. I look at those 500 people and I'm able to control for the county they live in. I'm able to control for their income level. I'm able to control for the exposures in their environment. I'm able to control for a lot of different things in my model building when I'm doing data analysis. And then through that analysis, I can calculate how all the different things that they're exposed to correlates to a greater risk for the outcome. So let's say that somebody, and we know this, we know that Black Americans have higher rates of hypertension. So we're able to see all of that, and a lot of it is, some of it is through GIS. So data analysis is used in all areas of public health. It doesn't only have to be when we're mapping, you know, environmental exposures. It's a bunch of different things, but we do use GIS concurrently with the data analysis techniques that we use in all areas of our field. It's pretty, you know, we're able to use a lot of the same tests for the same scenarios. You know, I can't speak on data and analytics for businesses or for money or any of those things. Really, I can only speak to how we apply it in biostatistics and everything that I do in public health. But I find it really fascinating. I think it's really interesting that you're able to control for different variables, and that is something that pretty much everybody use, I can imagine. So for example, if you're studying money, maybe you would control for, I don't know what you control for, honestly. I'm not a master in that, but I'm almost a master in biostatistics and epidemiology. So I think it's really fascinating. I hope that you guys learned something. I would love to hear if you have any questions. Some people also asked about project management, so I can share a little bit about that. I was looking through the polls and kind of seeing where most people were voting on, and some of it was project management, and then I'm going to talk a little bit about UVM, continuing distance education. So UVM, CDE, CLI, Center for Leadership and Innovation. It's also a center for learning. So project management. So recently, or since August, so for a while now, I've been managing a research project. So I can really only speak to, again, what managing a research project in my scenario looks like. But I was in charge of organizing meetings and connecting with our faculty advisors and our mentors and our professors. I was responsible for, keeping track of what everybody's doing. We would have meetings every week and we would discuss the data and the numbers and what we were finding, as well as the actual writing and editing of the manuscript. So I was in charge of making sure everybody was doing what they were meant to be doing. Things like, for example, my data team would present their data findings and I would say, well, what if we control for this factor? Can you show me what that looks like? Would that be something significant we would want to include? My team was really awesome and we were all able to work together. I definitely can't say that I was the head boss and did everything. They were all really, really awesome and I appreciate their work so much and I'm just so grateful for all of them. But just kind of looking at what I did as a project manager, saying, can we tweak this? Can we edit this? I think this would sound better. Just kind of making sure that the whole project flowed. So again, we work on a lot of projects in public health. We use GIS in our projects. In this specific example, we had access to a surveillance system that I again talked about in a prior video about public health surveillance systems. So we had a bunch of different layers to our data as well, but it wasn't fully a full map with a bunch of different layers. We kind of just got a map of seeing where everybody was and seeing the counties that were surveyed. So we didn't use a lot of GIS in our project, but it's something that I've been studying for at least the last year and a half of being in graduate school. It was something I learned about in my environmental public health course, but what I loved is that it applies to everything. I do want to get into the mapping inequities portion. So now that you all understand how we're able to see different things on maps and how we get the data from different places and layer it all together to get a bigger picture, I want to talk about what that means for looking at inequities in the United States, which is something, again, that we've been talking about. We've been talking a lot about, or I've been seeing in the media, talking about health inequities and disproportionate rates of different things for different groups of people. We hear the words disproportionate and inequity often. And understanding when something is disproportionate is huge, and it's something that we do in public health all the time, because if you have a population that's being disproportionately impacted by an environmental exposure, by a disease, by all sorts of things, that's a huge alarm for us. So for example, when we talk about, I heard this a lot when we were talking about police brutality. People would say, well, actually, when you look at the raw numbers, white people are also killed by police officers. More white people are killed than black people. But when you break it down, what we're really interested in seeing is it proportionate? So I do that a lot with hazard ratios and looking at the risk for one group and seeing if it's proportionate to how it should be. For example, if white people make up, let's say, 80% of the population, we should be being killed by police. Well, no one should be being killed by police. We should make up 80% of police brutality cases. That's proportionate. but we don't. In fact, Black Americans make up a way higher proportion of police brutality, instances of police brutality. It's the same thing within New Jersey. Black women are 6 to 7 more times likely to die of pregnancy-related causes than their white counterparts. That's, so what we're seeing there is that maternal mortality is disproportionately impacting Black women in this country. It means that Black women only make up, let's say, 8% of the state. It's higher than that. I'm just pulling this out. 8% of the state, but they make up 30% of instances of maternal mortality in the state. That's disproportionate. It should be closer to 8%. That would be proportionate. So we're really interested in looking at proportions when we're looking at inequities. So when I talk about mapping inequity, I mean how we can look at a map and see where inequity is at play. You can look at a map and you can see this neighborhood doesn't have access to different resources. This neighborhood has lower rates of insurance. This neighborhood is low income. This neighborhood is surrounded by power plants or agriculture areas. We look at Native American populations, and oftentimes because of where their land is and because of where they are, they're more likely to be living where there are these huge agriculture farms, and they produce a lot of pollutants, and so these groups of people have higher rates of respiratory issues. So when we're looking at equity and we look at it on a map, there are so many red flags that you see. You see this population doesn't have access like this population. These resources aren't being distributed equitably, and you can see that on a map. You can't see it on one map or two, but if you layer them all together through this GIS technology that I spoke about earlier, you're able to see it all together. So GIS stands for Geographic or Geospatial Information Systems. I forget I think I mentioned that earlier. This is what happens when I get a little rambly. But so we're able to pull from all of these different systems and get that big picture I was talking about. And that's when we're really able to see where equity comes into play with all these different populations. So I hope this was interesting. I think it's really important to have conversations about the technology and the science and how we come to understand these things, especially when they're in the media, and especially when people are talking about it on Instagram or anywhere. And I think it's important to understand the theory behind it. You don't need to know the theory to understand that something is right or wrong, or that you're passionate about something. But personally, I find it really interesting to understand how we get this data. Who's working with it? How do we use it? Where does it come from? How do we know this stuff? These are things that not everybody knows. I'm very aware of that, and I'm very grateful that I've had the opportunity to learn these things. It's been really, really incredible. There were some questions that I want to answer. All right, so some of you asked about my most rewarding experience, about what I want to do with public health in the future, what it's been like studying public health during a global pandemic. So I'm going to talk through all of that. The most rewarding thing has been able to share my knowledge with others. I believe I've spoke about it before, but I've had the opportunity to teach high school students over the course of the last, I did it for 2 different school years, and I taught a couple different courses. That has been rewarding beyond belief. I really can't put into words how grateful I am to have been equipped with the knowledge that I have, and to be able to share it with others has been just magical. Seeing the looks on my students' faces and hearing feedback from them, and it's just really, really awesome. Public health wasn't a field I knew about in high school, which has definitely changed, especially over the course of the last year and a half. So being able to kind of help others discover that they may see themselves in this field as well, just like I saw myself, has been just a really empowering and rewarding experience. But also I love learning. Just being able to learn has been so rewarding and incredible. I genuinely can't imagine what it's going to be like in 10 days when all of a sudden I'm done with school. I know that I'll be learning for the rest of my life, and I look forward to the learning that I have to come as I grow and I age and develop within myself and within this field. But it is going to be really insane to not be a public health student anymore. I can't imagine doing anything else. I really feel so fortunate to have found an area that I'm passionate about and that I feel like I can do for the rest of my life, and that fulfills me. It's magical, and I feel lucky every single day, even though it's really difficult. So let's go into it being difficult. Learning about public health during a pandemic has been one of the most exhausting and overwhelming and draining and incredible experiences I ever could have imagined. I feel so lucky that I'm entering the field at a time when public health workers and educators and all these different, when there's a huge demand for it. I can't express how grateful I feel to be in a field that is really needed right now and will be forever and always has been. But before COVID, before all of this, no one had an opinion about what I was doing. Nobody challenged me, which you could argue it's good to be challenged. 100% it's incredible to be challenged and to have challenging conversations. I tell my students all the time, I want to challenge you and I want you to challenge me, because that's how we learn together and that's how we grow and develop. And it's a huge and really important skill to be able to communicate information to people who aren't studying it. So it's been really incredible to see people become more interested and ask questions. And before all of this, no one gave any thought to public health. It wasn't something that people understood impacted them every day. Public health impacts you every single day, no matter what's going on, but it wasn't something people were really aware about. So as awesome as that has been, it's also been really challenging to have a lot of people just have opinions on something that I've dedicated almost 5 years to, and that I've been studying, and that I know a lot about. It's been a little bit taxing to kind of hear criticism or counter arguments that may not come from a place of fully understanding the topics and the issues at hand, but rather from just a place of opinions or fear or anger or frustration. It's been a really emotionally taxing year on every single person, and it's brought up a lot, especially when you're someone like me who's very outspoken and passionate about public health and sharing things, and to have kind of my passion and all right, so some of you asked about my most rewarding experience, about what I want to do with public health in the future, what it's been like studying public health during a global pandemic. So I'm going to talk through all of that. The most rewarding thing has been able to share my knowledge with others. I believe I've spoke about it before, but I've had the opportunity to teach high school students over the course of the last, I did it for 2 different school years, and I taught a couple different courses. That has been rewarding beyond belief. I really can't put into words how grateful I am to have been equipped with the knowledge that I have, and to be able to share it with others has been just magical. Seeing the looks on my students' faces and hearing feedback from them, and it's just really, really awesome. Public health wasn't a field I knew about in high school, which has definitely changed, especially over the course of the last year and a half. So being able to kind of help others discover that they may see themselves in this field as well, just like I saw myself, has been just a really empowering and rewarding experience. But also I love learning. Just being able to learn has been so rewarding and incredible. I genuinely can't imagine what it's gonna be like in 10 days when all of a sudden I'm done with school. I know that I'll be learning for the rest of my life, and I look forward to the learning that I have to come as I grow and I age and develop within myself and within this field. But it is going to be really insane to not be a public health student anymore. I can't imagine doing anything else. I really feel so fortunate to have found an area that I'm passionate about and that I feel like I can do for the rest of my life, and that fulfills me. It's magical, and I feel lucky every single day, even though it's really difficult. So let's go into it being difficult. Learning about public health during a pandemic has been one of the most exhausting and overwhelming and draining and incredible experiences I ever could have imagined. I feel so lucky that I'm entering the field at a time when public health workers and educators and all these different, when there's a huge demand for it. I can't express how grateful I feel to be in a field that is really needed right now and will be forever and always has been. But it's also challenging. There was a time when, in the winter when I was studying public health, I was teaching public health, I was living through a public health crisis. So there was a time when it felt like everything was closing in, this was all that I was doing 24/7 all the time. I had no escape. I was just at home. This was all that I was doing, and I was also feeling the effects of being in a pandemic while not being able to there was no escape. And I think it's important to have an escape sometime, and there wasn't one. But at the same time, it was motivating beyond belief, and I can't wait to be able to get out into the field and really dedicate my time to hands-on experience and helping people and just working to make the world a better, safer, healthier, happier, more equitable place for everybody. Which kind of leads me into the final question, which is, what do I see myself doing with public health? Again, this is another thing that, this is a very broad field, and I feel like all we've really been seeing in the media is, Dr. Fauci. He's an infectious disease expert. But there's so much more to public health. So what do I want to do? Right now, I'm really, really passionate about maternal and child health. I always have been. Looking back on my academic career, it was really when I learned about how awful the maternal health disparities are in this country. How if you're a Black woman, you are so much more likely to have risky pregnancy, low birth weight babies, infant death, maternal mortality. That is really what woke me up to the realities of the disparities that women experience based on just the color of their skin. So I would really love to work in maternal and child health. I would love to do any kind of work that helps make birthing safer for women of all colors, all races, all ethnicities, all income levels, all education levels. Health is wealth, but your health shouldn't be dependent on your wealth. You shouldn't be healthier because you have more money. You shouldn't be healthier because of the color of your skin. We have a huge issue with inequity in this country, and any work that I can do to remedy any of that is what I really am passionate about. But some examples of how I could do that: I love research. I could research all day, all night, all the time, whether it's just reviewing literature or whether it's doing it myself, whether it's crunching numbers or collecting data. I'm fascinated by it. I think it's so interesting and important. I think numbers paint incredible pictures of issues that need help solving. I also love cold, hard facts. You can't argue numbers. You can't argue facts. Some people may try, but I really believe that you can't. But numbers paint different pictures depending on how you control them and where you get them from, and all those things that I've kind of talked about a little bit here. So I would love to work in research. There are companies that are contracted by the government or by other organizations just to research different issues in order for them to then create and implement interventions in communities. So I would love to work in either research or program planning and management, or intervention planning and implementation. I would love to work in a community, but I would also love to work at a bigger scale. I feel like I have the whole world in front of me right now, and it's overwhelming and scary and incredible. And so I don't know exactly what it is that I want to do. I couldn't tell you, one position that I really want at one specific company. But what I really want to express and emphasize is that this is a broad field, and I really believe there's something for everyone, whether you're into quantitative data or qualitative data, whether you're not into data at all, whether you're a writer, whether you're a researcher or a scientist, whether you want to work in a lab, or you want to be out in the field collecting samples, or you want to be in communities working hands-on with people, whether you want to be managing a hospital or on the administrative side, whether you want to be on the financial side, there's something for everybody. And I think that's a really incredible, powerful thing. So again, I hope you learned something. I keep saying that. I keep thinking I'm done, and then I keep going, but but I just like talking about this stuff and just having kind of an informal discussion. And again, I encourage you to check out the University of Vermont's Continuing Distancing Education Center for Leadership and Innovation, because they have courses in all of the things that I've talked about. So they have courses on GIS and data analysis there, and data communication. They have project management courses that you can do online, or if you're in Vermont, you can do them in Vermont. There are so many different things that they have to offer. That's just at the Center for Leadership and Innovation. I'm technically a continuing and distancing education student, because their graduate school is part of that. My program falls under a bunch of different umbrellas and sections, and it's pretty confusing, but it's like continuing distancing education, the graduate school, the medical school, it all comes together to have this program. So I recommend you check it out. And you don't have to be a UVM alumni, you don't have to be a current student, you could be literally anybody. And if you want to just give yourself a competitive edge in whatever field it is that you're working on, and get some, develop a new skill, enhance a current skill that you already have, learn something new, kind of figure out how you can take something and make it into something relevant to your field. It's really cool. I definitely recommend checking it out. I want to thank them again for working with me. It's been really awesome, and I've just been really excited to share all of this with all of you. So thank you for watching. Let me know if you have any questions or comments down below, and I will definitely be sure to announce the winners. So thank you so much. I hope you all have a fabulous rest of your day.